Hello, I'm Dr. Johnson, and thank you again for joining me at How to Have Gorgeous Skin Show. Again, I'm your host, Dr. Johnson, and today we're in Indianapolis. Thank you again for joining me, Cheryl and Lisa. Okay, welcome to the How to Have Gorgeous Skin Show. I am your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and national speaker. I help women who have problems with their skin complexion and with the use of my products and lectures. After listening to my lectures and using my products, they will develop even and clear skin tones with increased confidence. If that's you, please follow me on Facebook.com/Dr. Sonia Johnson, DrSonyaJohnson. Okay, today we will be talking about part 2 on the 3 sex hormones that affect your skin. As I mentioned last week, estrogen. As you recall, estrogen is the hormone, a major player in the skin integrity. And what it does is, like I stated last week, it increases your collagen production as well as increase the thickness of your skin. And by doing that, it also helps with the barrier protection of your skin and increasing pigment production. Well, when you have a deficiency of estrogen, you would notice the skin is thinner. And we've seen in patients who have, people who are around their menstruals, develop sensitivity of the skin, in which they notice that, especially around laser, when we do hair laser removal, they cannot tolerate the settings that they're used to in the past. And sure enough, we have to either schedule them around times when they're not on their menstruals, or we have to lower the settings. Also, we notice that when the estrogen levels decrease and your testosterone levels stay the same, you have an increased production of oil. And that's because the estrogen actually helps block the testosterone. So it keeps a nice even balance. But when you have that low estrogen around your menstrual, you will have increased oil production. And another thought process with that is the imbalance between the estrogen and progesterone. Again, estrogen levels lower than normal, and the progesterone levels stay the same, and therefore you have also an increased reason for increased oil production. And some women complain of hormonal eating, or shall I say, binge eating, and that is due to that abnormal balance with the progesterone as well as estrogen. The second hormone is your progesterone. And like I stated last week, progesterone helps with elasticity of the skin. But when you have a deficiency of the progesterone, you will notice sagging skin as well as more wrinkle production. And then last is testosterone. Testosterone in high levels, women don't care for that because it causes increased oil production. And we see that with women who have polycystic ovarian syndrome. But also, when you have a deficiency in testosterone or a low level for the skin, that's a okay thing to have for women. Thank you again. Anyone have any questions? Alrighty. Well, thank you again for tuning in to How to Have Gorgeous Skin. Next week, we will be discussing part 3, the 3 sex hormones that affect your skin. Again, I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and national speaker. I help Black women who have problems with their skin tone with my products as well as my lectures. And after listening to my lectures and using my products, they'll develop clear and even skin tone with increased confidence. If that's you, please follow me on Facebook.com/Dr. Sonia Johnson, DrSonyaJohnson. Thank you very much.